Test taking tips, narrated by Shiver. I'm going to start off talking about the different learning behaviors that you can use when preparing for an exam. There are good behaviors, and of course there are bad behaviors as well. But good behaviors will include having daily study time. Study little bit by little bit each day, and then you won't be overwhelmed at the end when preparing for a test. You also need to have daily play time. You need to have some time to relax and rest your brain as well. So go see a movie, go walk your dog. It's recommended that you read the content before the lecture and use flashcards if that's beneficial to you. Some folks that doesn't work for. Group or individual studying. Groups can be good, but make sure you choose your group wisely. Make sure the group is staying on task and staying focused. Hourly mental breaks are a must. You need time to rest that brain. Bad behaviors include cramming the night before the test, rarely reading the textbook, or only studying the notes. As a teacher, we can only give you an overview of a topic. We can't cover the topic in detail. Be careful always studying with friends as well. Again, distractions do occur, and if you are going to study in groups, make sure you choose a group that knows what they're talking about. Noisy environment, we don't need distractors, so you need to have a quiet environment where you can study and focus, and also not taking breaks. You need to let that brain relax and process what you've been studying. More good behaviors, eat a good breakfast the morning before. For an example, complex carbohydrates. They'll stick with you longer and then you won't crash during the test. If you eat simple sugars or simple carbohydrates, what will happen is you feel great initially, but then you bottom out faster and then you don't feel so hot. So I recommend eating a good breakfast with complex carbs. Get a good night's sleep, a good night rest the night before the test, and then tell yourself, I am ready to take this test. A little positive affirmation never hurt anybody. Go in there with confidence. If you go in saying, I'm going to fail this test, there's a good chance that you probably will. Also, limit the caffeine before the exam. This can cause palpitations, but also can stimulate your bladder, so you may have to use the restroom. And sometimes there may be situations where you can't get up and go use the restroom during an exam. There have been studies done that show that wearing the color red will actually stimulate brain activity. So some students like to wear red to their exams. Bad behaviors would be not to eat or eat junk food the morning of the exam, staying up too late the night before. You're not going to be at your best if you stay up all night studying. You're going to be very tired. Don't give up after just a few questions or toward the end of the exam. Sometimes you may get discouraged because the questions seem difficult, but what if all the difficult questions are at the beginning and the easy ones are at the end? Also, don't get tired of taking a test and just start picking answers. Don't expect to know all the content on the test. I don't know all the content on the test. Your other instructors would probably tell you they don't know all the content on a test, but can you make a good, educated decision? One of the biggest issues students face is changing their answers. They start to second guess themselves, and they usually change what was a right answer to an incorrect answer. So, and the only reason I would recommend changing your answer is if you have misread the question and you know for certain that that answer is not correct. In most cases, your first instinct is going to be correct. Trust your instincts or trust your answers. Don't go back and start changing answers. I would estimate when a student raises their hand during a test because they have a question about something and they already have an answer choice chosen, I would say 95% of the time they have chosen the right answer, but they're trying to talk themselves out of it. So trust that first instinct. Another tip you can use when taking nursing tests is to identify the nursing process tested. Nurses always assess first. So if the question asks, what would the nurse do first? Then obviously you're going to be looking for an assessment answer. But if assessment answer is not one of your choices, you may be looking for an analysis or planning or intervention or evaluation type answer. So when in doubt, if it's asking what should the nurse do, look at your nursing process. That may help you decide which would be the best answer. You also can consider what's your priority. With emergent needs, these would be your ABCs, or your airway, breathing, and circulation. And without your ABCs, nothing else really matters. Emergent needs are going to be your first priority need. And I did include a worksheet on Blackboard that goes over selecting your priorities and prioritization. So please review that, because this slide refers to that worksheet. Your emergent needs are your first priority needs. These have to be met first. If you don't meet these needs, then the patient could have severe injury or even die. Okay, this is life or death situation. Your second priority needs are going to be safety, pain, and comfort needs. So we need to identify the client and the family's actual or potential concerns and problems. Your second priority needs are essentially what is important to the patient or the family. Is it pain or a patient request? It's things that the patient is concerned about or their needs. The third priority need are the unrecognized needs. These are things, actual or potential problems, unrecognized by the client or family. The third priority needs are maybe you have a serum potassium level that's abnormal, or maybe the patient's blood pressure is elevated, or maybe their urinary output has been decreased. Is the patient aware of any of that? No. Is it important? Well, absolutely. But these are third priority needs. Your fourth priority needs would be future needs, or planning for future interventions. And they may be actual or potential problems that the client, family may need help with in the future. And this may be teaching about insulin administration to your patient, or preparing for discharge, or things of that nature. So these are all planning ahead, or planning for the future. So looking at all four of these again, with your emergent needs or your first priority needs, these have to be taken care of first, regardless. After the emergent needs are met, we can make the second order needs, which include patient concerns, patient safety, maybe pain. So what are the patient needs? The third priority needs would be dealing with abnormal lab work, maybe medications that need to be given, things of that nature. And then future needs would be planning ahead. So when you have questions related to, well, which patient would you see first, or which patient takes priority, you can use these four different priority needs to determine. If you're still stuck on what your priority should be, you can always go back to Maslow's hierarchy of needs. The premise of Maslow is that you have to meet the lower level of needs first before you can move up to the upper level needs. And if you look at the pyramid here, it's pretty self-explanatory. But on the lower level, we have the needs such as the physical survival, which include water, food, sleep, warmth, exercise, and things of that nature. Before we can progress up the pyramid and have self-actualization, we have to meet the basic survival needs first. We have to have nutrition and food and sleep and warmth. And then it moves up to safety. Okay? So meet the lower needs first, and then you can move up to the self-actualization needs. So if you get stuck with a question on a test, look and see where are the basic needs met first before you move on up to self-actualization. When in doubt, you can always ask your patient which action would directly benefit the patient the most. In other words, what's most beneficial to the patient. If you were comparing documenting I&O versus changing a patient gown, they're both important, but what would you do first? You would change the patient's gown first, because the patient would directly benefit from you changing their gown. Does the patient benefit from the fact that you have documented their I&O? Although that's important, they don't directly benefit from the fact that you wrote down their INO. Taking a temperature versus allowing the patient to eat lunch. A lot of times vital signs are due right at 12 o'clock, and that's when their meal trays come. So what's more important? We can wait on that temperature until the patient gets done eating their lunch. Them actually eating their lunch would benefit the patient more. Ambulating in the hall versus a dressing change. That one can be kind of tricky. If this is just a simple dressing with no drainage, let the patient ambulate in the hall first. They could benefit directly from that as opposed to the dressing change. So you can always say, what's the patient going to benefit from the most? I do recommend noting the time parameters when answering test questions. Treatment for a patient is very different day 1 versus day 3 post-op, for example. Is the question asking about preoperative versus post-op care? That's going to be very different. What we did before the patient before surgery versus after is very different. Is the question wanting to know about something during a procedure or after a procedure? Before or prior to are also key words. So you need to tune in to the time parameters that are indicated in the test questions. And we're going to practice some of these in just a minute. Also consider what is the client's age. Consider what their developmental needs are, and also the normal physiological states of aging. Each group has different teaching needs as influenced by their mental capabilities and physiological functions. And that makes sense. The care for a 6-year-old would be very different than the care of a 20-year-old versus the care of an 80-year-old. So that makes sense. Most of all, do no harm. Hippocrates stated, above all, do no harm. So a good rule to keep in mind is to start with the least invasive intervention first. And a great example of that is if you have a patient that is maybe disoriented and becoming combative. We wouldn't automatically throw them in restraints. We would start talking to the patient first, see if we could calm them verbally. So always start with the least invasive intervention first if possible. Also consider actions that may prevent a problem, because that's more desirable than waiting for a problem to actually occur. I've worked in facilities where the hospital was very proactive in preventing problems and taking action so problems didn't occur. But I've also been in facilities where they would wait for the problem to occur and then they would fix it. So be proactive and try to prevent problems before they occur. Plan ahead. Another hint is to consider the scope of practice of the people involved in the test question. You need to consider the necessary interventions that fall within the scope of nursing care. So what interventions can be carried out by an RN or an LPN or an unlicensed assistive personnel. So make sure you stay in your scope of practice, and we'll learn more about that as the semester continues. If you find unfamiliar words in the test stem, and that may happen, see if you can reword that test question without those unfamiliar words. Because sometimes distractors may be in the stem of the test question, but the test question is asking something simple, not even related to those words. Also identify words of essence, such as acute versus chronic, always versus never, except versus including, or first versus initial. If you miss one of those key words, you very well could choose the wrong answer on an exam. We need to pinpoint specific locations that the test question may be referring to. Is this happening in a hospital, or is this in an outpatient center, or is this in the patient's home? Is it in an extended care facility, post-anesthesia unit, or intermediate care facility? And a great example of this is if you put in a Foley catheter in the hospital setting. It is a sterile procedure. Now, if the patient is doing self-catheterizations at home, it's a clean procedure. So make sure you pinpoint the specific location that the test question is referring to. Also look for distractors or mystery diseases or absurd conditions. Frequently test questions do have distractors in it, but you've got to learn to, well, what's important and what's not. And a great example of that is the client walked naked, or the client walked in the hall naked. Some students may read that and get so distracted by the fact that there's a naked person in the hall that they totally lose sight of what the question is really asking. So make sure you overlook those absurd conditions or those mystery diseases. There also can be words that don't count. For example, if I tell you there is bright red blood on the dressing, some folks may get excited. But if I tell you it's the size of a dime, then we're not quite as excited. Or if I tell you there's massive edema present, massive edema, well, we'd like to know where. Of course, if it's at the throat, then we have an emergency. But if it's in my pinky toe, well, that's a whole different story. So make sure you're not getting drawn into emergency words that really are not relevant. Another hint is if you have opposite answer choices, there's a good chance that one of those answers is going to be correct. So if you're stuck on a test question and you see opposites, I would go ahead and eliminate those other two answers and just look at the opposites. You're going to have a 50% chance of getting that correct. Umbrella answers are also important to identify. And these are answers that are more inclusive or include the other answer choices. And I've got an example here. In a nursing assessment, which of the following is most important to obtain? Well, if you read all of them are important to obtain. But if you'll notice, choice D, vital signs, is all inclusive. It includes A, and it includes B, and it also includes C. So that's an umbrella answer. It includes all of the other ones. Let's do some practice questions. What is the most common reason why an elderly patient becomes incontinent of urine? So we're looking for the most common reason why an elderly patient becomes incontinent of urine. A reads, the muscles that control urination become weak. Is that possible? Sure. Let's look at B. The aged tend to drink less fluid than younger patients. That is a true statement, but is that what the question is really asking? Choice 3, their increase in weight places pressure on the bladder. Well, as a patient ages, most likely they're going to have a decrease in weight. And then choice D, they use incontinence to manipulate and control others. Is that a possibility? Sure, but the question was asking what's the most common reason elderly patients become incontinent of urine. So the best choice would be A. Question number 2. While making rounds, the nurse finds a patient on the floor in the hall. What should be the nurse's initial response? So you find a patient in the floor. What should you do first as the nurse? And nurses always assess first. So, should we inspect the patient for injury, transfer the patient back to bed, move the patient to the closest chair, or report the incident to the nursing supervisor? Now, all of that probably needs to happen, but what should we do first? And choice A is the only option for assessment. So we need to inspect the patient for injury. Something I do want to call your attention to, if you look at choice B and C, they are essentially saying the same thing. You can look for answer choices that are saying the same thing, and that possibly will help you eliminate 2 of your answer choices. Number 3, what should the nurse do immediately before performing any procedure? Should you A, shut the door, B, wash your hands, C, close the curtain, D, drape the patient? Well, if we're going in to give medications, we won't necessarily need to shut the door, close the curtain, or drape the patient. And the question's asking before any procedure. So the only correct answer could be B, wash your hands. Another thing to note about this question, the purpose of choice A is to provide safety. The purpose of choice to provide privacy. The purpose of choice C is to provide privacy, and the purpose of choice D is also to provide privacy. So we have three similar answers and one that's very different. So B is the correct answer. Before performing a procedure, what should the nurse do first? Your initial instinct would be to look for an assessment type answer, but that's not a nursing process type question. So, should we raise the patient's bed to its highest position, collect the equipment for the procedure, position the patient for the procedure, or explain the procedure to the patient? This goes back to what would the patient benefit from the most. If you look at choice A and choice C, they both have to do with positioning or getting the patient ready for the procedure. So, would the nurse collect the equipment for the procedure or explain the procedure to the patient first? The patient would benefit more from the fact that we took time to explain the procedure to them. And keep in mind, patients have the right to refuse. So we don't go get all our equipment and bring it into the bedside and then tell the patient, because they could refuse. Okay, so the appropriate answer would be to explain the procedure to the patient. A patient has just returned from surgery with an IV and does not have a gag reflex. So some key things to tune into. They have just returned from surgery, so they're probably sedated or somewhat groggy. They do have an IV but no gag reflex. So airway is definitely an issue. Which planned intervention takes priority? All of these interventions need to be done, but which one would be the priority? Should we ensure the adequacy of their air exchange? Observe their dressing for drainage? Check the IV for infiltration? Or monitor their vital signs? Well, going back to our prioritization, we have to look at our first order priority needs, which would be A, ensure the adequacy of the air exchange, airway, breathing, circulation. Now, do we need to check the dressing? Sure. Do we need to check the IV? Absolutely. Vital signs important? Yes. But you have to start with the ABCs first. Number 6, when the physician orders that a patient be kept NPO, and NPO is nothing by mouth, the most important action by the nurse should be to A, allow the patient to sip clear fluids with the medication. B, give the patient mouth care every 4 hours. C, measure the patient's intake and output. And D, permit the patient to suck on ice chips. Well, if NPO means nothing by mouth, we can eliminate A and D because they're both allowing the patient to have something by mouth. So that leaves us with B and C. Should we give the patient mouth care every 4 hours or measure the patient's intake and output? Both are important, but what would the patient benefit from the most? And the correct answer would be B. Question number 7. Patient has a high temperature, they're diaphoretic, and did not sleep well during the night. When planning for this patient's hygiene needs, the nurse should A, give a complete bed bath, B, do a partial bed bath, C, delay the bath until later, or D, provide only perineal care. If you look at your choices here, A says we'll give a complete bed bath, C says we'll delay the bath until later. If you compare B and D, we're just going to wash parts. We're going to do a partial bed bath on B and only perineal on D. So we have interesting choices here. The patient has a high temperature, they're sweaty, they didn't rest well during the night. What should we do? Well, we can go ahead and eliminate B and D because they're saying essentially the same thing. You would just wash parts. Looking at A and C, we either give the bath or we don't. And your first reaction might be say, well, let's not give the bath, but if they have a high temperature and they're sweaty and they didn't rest well, if we can give him a complete bed bath, that will help lower his temperature. He'll be in a clean, fresh bed, and he'll be able to rest a lot easier. So A would actually be the best answer in this situation. A child is admitted with the diagnosis of Odine's curse. In the assessment findings, the nurse would expect to see. And this is a tricky question. This is a mystery disease or an absurd condition. Probably most of us have not heard of Odine's curse, and it does actually exist. So say we don't know anything about this. Can we make a good answer choice based on the answers provided? We would expect to see A, a low oxygen saturation, B, dilated pupils, C, normal oxygen saturation, or D, increased deep tendon reflexes. Consider we know nothing about this curse, I would choose a low oxygen saturation just because you have opposites. A and C are opposites. And a student told me earlier, well, if it's a curse, well, then you probably wouldn't have a normal oxygen saturation. So that's one way to look at it. So it is actually a respiratory disorder. But if you don't know what something is, see if you can make a good guess based on the information provided. So A would be the correct answer. Question number 9. A patient tells the nurse, my new bathrobe is missing. The nurse's most appropriate response would be to A, determine if the patient is angry, B, initiate a search for the patient's bathrobe, C, provide an isolation gown that can be used as a robe, those blue plastic isolation gowns, D, state that it must have gone down with the soiled linen. So the most appropriate response by the nurse would be to, I would imagine the patient, we could tell the patient was angry. Plus, determining if the patient is angry isn't actually addressing the issue. Should we initiate a search for that bathrobe, or provide an isolation gown, or state it must have gone down with the soiled linen? D is kind of blowing off the concern of the patient. Well, it's gone. It went down with the linen. So we're not doing anything for the patient in that instance. Giving them an isolation gown, a blue plastic isolation gown, can't be used as a robe. That wouldn't be appropriate. So we would need to initiate a search for the patient's bathrobe. Now, could that be delegating to somebody else to go look for it? Sure. But that is actually doing something for the patient. So the best answer would be B. When rubbing a patient's back, the nurse should never, when you see never in a question, never means never. There's no exception to the rule. Should you never A, knead the skin, B, wipe off any excess lotion, C, use a continuous firm stroke, or D, put pressure over the vertebrae? So we're looking for something we should never do. Sometimes we do knead the skin when we're doing a massage with a bath. Wipe off excess lotion. This is indicating we're just going to let the lotion drip off of them if there's extras. So B is not correct. C, use a continuous firm stroke. Well, we actually can do that as well when we're doing a massage. But you would never put pressure over the patient's vertebrae. So D would be the appropriate answer in this case. Question number 11. The physician orders a 2-gram sodium diet. Which group of nutrients would be most appropriate for this diet? If you're looking at the choices given and you're stuck, look for comparisons or look for similarities, things that you can compare. If you compare B, C, and D, you have a processed meat and condiments, both very high in sodium content. A actually looks very different from the other three. And sometimes with questions like this, you can look for similarities if you're stuck and make the best answer choice. So the best answer actually is A, fruit, vegetables, and bread. Question number 12. After surgery, a patient complains of mild incision pain while performing deep breathing and coughing exercises. What would be the nurse's best response? So some key words: after surgery, mild incision pain while performing deep breathing and coughing exercises. Would the nurse say, each day it'll hurt less and less? That's not being very empathetic to what's going on with the patient. Would you say, this is an expected response after surgery? Well, it may be, but that's not what the patient wants to hear. Choice C, with a pillow, apply pressure against the incision. That may be appropriate. And then choice D, I will get the pain medication the physician ordered. If the patient was complaining of severe continuous pain, well, then we might consider giving the pain medication. She's probably going to have some discomfort or some mild pain while coughing and deep breathing. So the best answer choice would be C, with a pillow, apply pressure against the incision. Choice A and choice B are not very sympathetic to the patient's needs. Question 13. Patient with acute pancreatitis is experiencing vomiting and has an accumulation of fluid around the bowel and pancreas. Which would be the most important for the nurse to assess on an hourly basis? So which of these would you assess on an hourly basis for the patient with pancreatitis? Choice A, ability to move lower extremities. Interesting. B, shortness of breath and pain. They're probably going to have some pain and some shortness of breath. Choice C, bowel sounds and body weight. Bowel sounds good, but hourly body weight? And then D, vital signs and urinary output. Okay, so I'm not too sure about A. That just sounds odd altogether. B, shortness of breath and pain would be an important assessment. And I think I can get rid of C because bowel sounds maybe, but hourly body weight? So I've narrowed down my answer choices to B and D. But the question is wanting to know, what would I assess on an hourly basis? D is actually going to be the correct answer, and I'll tell you why. If your patient is having shortness of breath and pain, which they will have with an acute pancreatitis, are you only going to check on this patient every hour? Hopefully we'll be in the room a little more often than hourly. So on an hourly basis, vital signs and urinary output would be appropriate. If you sat here long enough and thought about this question, you may start second guessing yourself, and you may actually decide, well, A is starting to look pretty good. But don't second guess or change your answers. Go with that first instinct. Question number 14. You observe a client pacing in the halls, and it appears as if the client has been crying. What is the most appropriate action by the nurse? Would you A, consider the behavior normal to the illness? B, validate the perceptions with the client, and what that means is go over there and say, are you upset? What's going on? Discuss the client's actions with another nurse for verification, and what that means is you would slide your chair over next to somebody and say, hey, does it look like they've been crying? Choice D is discuss the morning schedule with the client to decrease their apprehension. The best answer choice would be to B, go validate the perceptions with the client. A is ignoring the patient's needs, just saying, oh, this must be normal with their illness. Well, there may be something going on that we're not aware of. We need to go validate those perceptions or go see what's going on with the patient. C would not be appropriate. We wouldn't just discuss what's going on with another nurse because the patient doesn't benefit from that. And by D, going to discuss the morning schedule with the patient is actually ignoring the actual issue as well. You're avoiding the issue. Question 15. In order to provide care to clients, the nurse would give high priority to which information received in shift report? This question's a little wordy, so I'm going to read it again. In order to provide care to clients, the nurse would give high priority to which information received in shift report. So in other words, what do we need to hear in report? What's the most important thing to receive in report? Is it A, physical assessment data and client's response to care? Well, that would be important to know. B, client's list of active and resolved problems and associated medical treatments? Maybe. C, physician visits and new orders? That would be important to know as well. D, intake and output data and vital signs. I'd actually like to know all of it. But when you're passing report to the next shift, the most important of all these would be the physical assessment data, what's going on with your patient right now, and the response to the care that's been provided. That would be the most critical information to include. It also shows that the healthcare needs of the patient are being met. Question 16. The nurse is caring for a male client who has recently had his left leg amputated. To assess body image, the nurse should gather subjective data such as So some key words in our STEM here. Patients had their left leg amputated. We're looking at body image assessment, and we're looking for subjective data or something that has been said, something the patient says. So would we want to know the client's feelings regarding surgery? B, strength of the femoral pulses bilaterally? Well, that's objective. That's not subjective at all, so we can eliminate B. Would we want to know C, the client's description of his personality? Or D, the status of his wound healing? D would also be objective. So that leaves me with choice A or C. The one of the two that best assesses body image would be choice A. Other test-taking tips. Take a deep breath. Answer the questions as you are working at Utopia General. What that means is when you answer test questions, you need to imagine that you have all the resources you need. Everything's going to be available, because sometimes we make decisions based on our previous experiences. But at Utopia General, where we are when we're taking these test questions, you have every resource that you possibly could need. Also, don't spend too much time on a test question. It may be you get stuck on one difficult test question, but you may know the answers to the rest of them. But you're losing time because you're stuck on one. Sacrifice one question and get all the other ones right. Also, avoid referencing personal work experiences, and that can be difficult, especially for students who have a history in the healthcare profession, whether you're an LPN or a paramedic. You have to avoid referencing your personal work experiences and read the question as it is. Well, I hope you find some of this information useful.